Hello, this is Michael Hexter. Welcome to Politics 2100 here on YouTube. So this episode I'm calling Neoliberalism, Impulsiveness, Left/Right Populism, Doom's Anti-COVID Public Health Effort. So if you have been listening to these videos in Politics 2100, I've been treating the anti-COVID effort as a giant cooperative, or I've been discussing it as a giant cooperative effort organized by government, and that this is something that's anathema to the right-wing ideologies that have really dominated American society over the last 40, 50 years. And also, some of those ideologies stem from neoclassical economics, and that 40, 50-year period is also the period that we could call the neoliberal period. So anyway, we're seeing right now, this is a response to the current situation we have where there's confusion, and the lines that were drawn, I'm seeing among people I follow on Twitter and also in news media, in terms of both news reports about what people are saying and what actual governments are doing in terms of their response to COVID-19 and their changes in at least tone, if not actually in policy regarding COVID-19. So this is a response to that, and I'm trying to create an overview of the current situation because it is chaotic, and we see a splintering of the different blocks of people as they arrayed around, in terms of opinion groups and so forth and so on, as they arrayed themselves around the issue of COVID-19, the pandemic, and also the response to the pandemic. So, and this is all happening when we've had the Omicron wave, and we still are seeing a very high level of lethality, or just of deaths, okay, in terms of, or that we still see a slight, somewhat of a rise in deaths because of the surge of the Omicron wave that is now breaking, or that it's now subsiding. And so what we have, though, are moves, for instance, in New York. We have a loosening of mask mandates instituted by the governor, and also we have other changes. We had the CDC shortening the quarantine period to 5 days. So a lot of this is, and I'm also taking off from a very good discussion of this earlier today on the Majority Report, where Sam Cedar was sort of summarizing this in a way as governments responding to business interests, saying, and also their own interests as tax collectors, because local governments and state governments are dependent on tax revenues, and those are really dependent on commerce, that sort of a coalition of these groups, not publicized, but in an unpublicized way, that they are simply saying we can't survive anymore, and we need a complete opening of society and a lapse of almost all public health measures. Now, New York is keeping their mask mandates in schools, so we don't have a complete collapse of, that's for public schools, obviously, but we don't have a complete collapse of all the measures that have been instituted during the pandemic. But now we're at a level, though, where there are hardly any restrictions. So even these changes are not radical changes, because the United States at almost any point had never adopted, for instance, Australian level, New Zealand level, or Chinese level mandates and measures like contact tracing, quarantining, so forth and so on. And it's being discussed in a way as the difference between a zero COVID policy and the current U.S. European mix of very scattershot public health measures. In some countries instituted more rigorously and also more effectively than in the United States. So, but the worst offenders in this area, in this melange approach to public health, were the Anglo-American countries, United States and Britain. And we've relied on this technical fix of vaccines and relying very heavily on that and thinking that everything else we can just sort of allow to slide. And so I'm also seeing, so in describing this broken field of different changing attitudes to COVID-19 and to public measures or state-led measures to combat it, that I'm seeing that I'm calling it left-right populism. So people are appealing, their various people, and some of them are reflecting on their own situations. And look, there are a diversity of situations of people who find themselves, people who have young children, they need to go to work and so forth and so on. They have to physically go to work, so they're more sensitive to, for instance, school closures or other measures that, or just the shortage of teachers that led to schools being half-staffed because of the Omicron wave. So anyway, so there's a whole series of interests, and people have kind of fallen on either side in some sense of the ideas. For instance, also the masking of children, which is an issue that I see the groups, the news sources that I follow, which are mostly left of center, or almost all of them are left of center in some form or other. They seem to be speaking about two different sides of this issue. Some are saying, we need to relax. We need to. People are suffering because of government measures. Now, again, some of this is phony. In other words, there are very few restrictions that are in the last several months. There have been very few restrictions on people's behavior. So it's just a matter of people, as is commented on by a number of people in streaming media, people are just afraid of being sick or getting sick, and they see also the numbers. And so there's a certain governments are being blamed for what essentially is the private hesitancy of people to engage in commerce and to go out and eat in restaurants and so forth and so on. So even though those restaurants are open, so there's not a restriction. And also I live in New Jersey, and there have been some interesting backstories about how in New Jersey we see very few restrictions at all and very few mandates about masks and so forth and so on, in part because the governor was scared by his near miss in winning his re-election last year. Phil Murphy is his name, and so they've been very frightened of the anti-mask and anti-vaccine mandate lobby, and so we have I'm calling it left and right populism. We have it's mostly right-wing populism that has been arrayed against, and we have to be careful to not lump the two populisms together. But in this case, there is some overlap in that I see people who are commenting, saying that they're very impatient to get for everything to be open again, and a lot of this is predicated on. So this is where impulsiveness comes in. a lot of this is predicated on a very optimistic view of Omicron and of the current variant, the current dominant variant in the United States, if that's Omicron or a combination of Omicron and Delta, that that is per infection relatively mild, and so basically with the hope that hospitalizations and deaths will be low per amount of infection. But the variant is so infectious that we have very, very high death rates still in the order of about 2,500 to 3,000 a day. So we're talking about a cost of this kind of laissez-faire attitude in the order of 200,000 deaths projected, not yet incurred, for at least this latest 2-month period or so, 2.5-month period, with the coming of the current wave of COVID. I mean, that's guesstimate wise, and so I mean we're at about 900,000 deaths official, and we're probably over 1 million deaths unofficial for COVID-19 since March of 2020. So so anyway, the impulsiveness comes in when if only governments, if politicians could wait for 2 weeks to do these announcements, to do these measures, if only they were not paralyzed enough in their thinking to say, let's temporarily do remote schooling or do instead of instituting it as a a semester long phenomenon, or a hybrid model of schooling, in person and at home, or remote and together in class. And so there was really no one trusted themselves, it seems, or very few government officials and school officials and so forth and so on trusted themselves to be flexible enough to read the data and then design a response to whatever the data said about the caseload or the concentration of virus in the general community. And so therefore, literally we were unable to plan. So this gets back to the sort of the big issue of can a society like ours really do a public health response to anything? And then furthermore, stepping back, this is where the whole issue of social cooperation and social coordination and individualism to some degree comes in that the climate crisis is an even bigger and challenge to be able to coordinate. In other words, to do an effective climate response, one needs to coordinate and collaborate and do things, do some also sacrifice or thinking about other people on a scale that is an order of magnitude greater. Thinking about other people, the pandemic forces you to think about other people that are currently alive, or currently alive, an adult and in the room or near you in your physical proximity. The climate crisis requires you to think about people who are either very young, people who are across the world, people who are also about to be born, and your future children or grandchildren, and also those of other people. And so it requires an expansion of thinking and a consequent regulation of people's impulses to plan out how you're going to either do politics, do work, and also consume. So and do politics is, in my mind, the most important thing in terms of who you're going to support, what are the political measures you're going to support, and also what are your personal allowances for government to help structure that. Okay, and with the current right wing, they have no tolerance for that kind of a program, which is about progress and about government-led progress and a government-led uh, um, thoughtful, rational process that is actually requires not only dictates but also a process of intelligent participation and feedback to about what works and what doesn't, because no one has this all worked out, and there's no big plan that anyone has that will solve every issue, every challenge that would face us to transition off fossil fuels and to a sustainable agriculture and land use policy. So all of that requires a level of social coordination that is, again, an order of magnitude greater than our response to the pandemic. It involves different sets of sacrifices and whatever, or different sets of impulse regulation. So anyway, so this also this kind of getting back to the issue of populism, and also left populism in particular, which is close to my heart, that we have seen over the last few years, even before the pandemic, a kind of a split on the left between, or let's say there's a part of the left that split off and is now is actually has actually joined the populist right or the neo-fascist right, or they have been running interference for the neo-fascist right. They're maybe not part of it yet, but anyway. So, and part of the attraction of those two groups, the group I'm thinking of Jimmy Dore and Glenn Greenwald and so forth, so on, is that they, even though Glenn Greenwald was never decisively of the left, and Jimmy Dore, I guess he flirted with it certainly, and he was part of TYT, and he once claimed that he was for Medicare for all. Now he seems to be propagandizing against Medicare for all. So anyway, so this this issue of and there are other people, for instance, Crystal Ball, who was kind of left populist, and she actually started the program Rising with Sagar and Jetty, and their commonality was kind of a populism. In other words, she was a left populist and he was a right populist. Rising is now as different people, but they still have this sort of populist and also anti public health, I would say, or anti egghead or sort of attitude, and in a way, this opens up a big issue, I think, for the left in general, because there has been a kind of a tendency on the socialist left too, not just that program which is not socialist in orientation at all, to refer to popular sentiment and popular desires as being paramount in a left politics and socialism and so forth and so on. But when you have a pandemic where a government official or government officials or public health officials are forced to choose unpopular options, I don't think that's necessarily antithetical to a left politics. And I think it's actually integral to a left politics. That left politics needs to be also rationalistic and not just populistic. Okay, I think being rationalistic and populistic is ideal but sometimes you need to stand up and have leadership and say, we need to be doing something that we don't want to do. We need to regulate our impulses, okay? Having impulse control. Now, this is something that is kind of the right wing sometimes, or the sort of, not the neo-fascist right wing so much, but sort of the kind of conservative or old style conservative idea about, self-control and so forth and so on. And but there has to be a measure of self-control in order for people to live in society, and socialism is about recognizing our social nature and optimizing it and using it as part of our politics. Again, this is a gloss, an interesting and original gloss on what I think socialism might be or is trying to do, or has been trying to do. But and it has only done that in a partial way, and it hasn't done it in I think, a systematic way based on our best understanding of society and biology and a whole bunch of other things, and physics, and particularly regarding climate change and the laws of thermodynamics and so forth and so on. But anyway, this public health, there are, let's say, I'd say public health measures are most popular among sort of the centrist base of the Democratic Party, which is now being, in some sense, betrayed, I think, by some of the leadership of the Democratic Party. So with unknown effects, okay, on that base. But that base is the highly educated base of the Democratic Party. Is in some sense wedded to, and has been using the pandemic in some sense to reinforce its sense of self-worth by saying, well, we're the good people who look out for other people by getting wearing our masks and getting vaccinated and so forth and so on, and being lampooning or being scornful of the impulsive and crazed right wing with good reason. I'm not opposed to that. I have been myself on this podcast or in this video cast scornful and critical of the right wing misinformation envelope in which people are ensconced, and also people's reaction, which is in some sense about their own, I think, impulsiveness and egocentric, and it's entirely egocentric in some way. But anyway, we have this group, the centrist, Blue Wave, the K Hive, whatever it is, the other people who, get a certain feeling of superiority by following public health measures and by, and it's not unjustified to do those things, but also, again, adjusted to the reality, the actual reality of what is the concentration of a virus and the probabilities of getting infected with it if you do certain activities. So anyway, so I think we now have a situation where it's not clear how it's going to come out, okay, other than a couple 100,000 people will die, maybe more, maybe a little less, because of the lack of a government federal government coordinated response to the end of the Delta wave and the beginning of the Omicron wave. And a fear of the radical right, a fear of the the anti-vax and anti-mask base, the operate these often extremely misinformed, sometimes suicidal and homicidal activists who have all kinds of interesting fixed ideas about health and and vaccines and so forth and so on. And but anyway, uh, the government has also, for instance, Fauci is someone who uh, did some good things during the pandemic and has had done throughout his career done some good things, but is also now a liability in term because his he it's likely that he lied to Congress about the the lab leak theory, and which is likely true. It's not 100% proven that it's true, but it has some merit and for the origins of COVID-19 or SARS-CoV-2, CoV-2. But he seems to be in self-protection mode, and also, you know, he would. I think he's a liability for anybody who embraces him. He's been considered to be one of the heroes for this, um, uh, this group of people who are supposedly public health fans. So anyway, so I think that this moment splits apart many of our preconceptions about our society, what are different political wings, and what are they, what constitutes their politics and their philosophy of life. And I think there are, real progressive and humanistic solutions to this chaos that we find ourselves in, but they are not easy, and it will take a while for us to work it out. And I don't know if we have that time because, among other things, the supposed leaders of the kind of Enlightenment, centrist, maybe slightly left Democratic Party and whatever, seem incapable of really fighting the radical right and the Republicans in any consequential way, through failures of leadership, among other things, and cowardice and corruption. So, and that might lead to a takeover, by the radical right in the next few years. So, a neo-fascist government that will be hard to displace anytime soon. So, so I hope this has been somewhat helpful in terms of running through some of the issues that I think are out there and that are part of our current situation. And I hope that in the next few weeks or so, I can do another video that can clarify some of the shape of these political realignments that are, unfortunately, some of this is about institutional and technical and epidemiological responses, but it is also political, and the politics need to be understood. So anyway, so I hope you got something out of this video, and so if you did, please like it, and also please share your comments in the comments below, and maybe we can discuss some of these issues in more depth. And also, if you're liking the content on Politics 2100, please subscribe, and I look forward to seeing you in the next video.